remember just doing a TikTok the other day about telling people about syphilis, and it's missed first stage. You kona kakidonda to private part.
Like sicker patients?
Yeah.
What's the commonest
issues? So let me start with this. There is even my own family was not so happy hearing I'm going to do dermatology. And the problem is of the misconception out there. You want your daughter and your son to be a surgeon.
Yeah.
And
real
then
medicine.
it feels like dermatology is this. What are you doing?
Yeah.
But I'm telling you, even up to today, there are people who find me in theater and they're like, wait, Dr. Gashiri, what are you doing here? Even when I came back, like even in Meru Hospital, and I want a theater space, and they can't believe, like, what are you doing here? And then, right now they know, they understand dermatology more. And I'm talking about other healthcare workers, other doctors, other specialists, nurses, and then you can imagine out there.
Later you're going to tell us what the surgical dermatology.
So dermatosurgery, it's huge. But the point was there are actual really heavy conditions in dermatology, really sick. Sasa tumeongea about sun and someone is like, that's how you do. I'm telling you, those are
the
by the way.
That is what the privileged you who is watching this thing.
These are not by the way, they're equally important, but there's so heavy things in dermatology. There's also emergency dermatology.
Really?
Yes. So these, like right now, okay, of course I can't show the pictures. Like there's a child who has gotten born and they have blisters everywhere. And
at birth.
Yeah. So there are those neonatal issues. This emergency, when you talk of SSSS, TENS, that's dermatology, of course. And so many other things as well. And blistering conditions that are chronic, skin cancers, even all the ones we were talking about. There's this common one that get missed. You look like you have eczema, mycosis fungoides, and it's missed, and most people will come when they're on the other side of the spectrum. Yet it stays many years and you get mistreated. Then there are infections, and then there are those things that you see, like if someone was to come with secondary syphilis, you can easily miss. Dermas are trained to capture that, and we've captured many. And I remember just doing a TikTok the other day about telling people about syphilis, and it's missed first stage. You kona kakidonda to private part, then unataka kungoja, and then it disappears, and likely that syphilis are missed. Then second stage, dermas mostly will capture it. It will be hard for anyone else to really, of course there are physicians, there are people who've seen these things and they'll capture. But for example, like I had a patient who had patchy hair loss, you see, and of course they had been treated before, blah blah blah, and they came to me, the hair is not growing. What? Syphilis. You see. And those are things we were taught, but they'll likely disappear. But now, like a dermatologist, you know what to look for. You have patches on the hands, nothing else, likely syphilis. It could be. So we have to do tests for you. And then remember, if you miss that stage, which is missed a lot, because also, we don't really have access to specialists, that physicians, pediatricians, as such, dermatologists, we don't. So this stage is missed a lot. And then what happens? They come in tertiary stage. Tertiary stage, unajua mambo mbaya. The heart is messed,
the
brain is messed, and things like that. And then there are just so many things that we do and we sort. But you're asking about common conditions. So if you see generally, so in mashinani, there's heavy dermatology issues, like extremely heavy.
Serious things.
Like even right now, I've received from our county government, like there's a village, they've raised an alarm. There's a village with all, so I have pictures here, they have wounds, like they have realized it's a whole village, and they had to cluster them in a certain, I think, church or school, and we figure out what is happening.
Everybody, like it's like an
not
outbreak.
Everybody, but like so many people. Okay, and then we need to figure out what is happening. If it's a worm, it's something like we call podoconiosis. We are still to figure out is happening.
On the legs.
But the point is, in mashinani, there are things happening. And you see, these are people who didn't really have even early access to dermatology and things like that. But now if I was just to sit in a clinic, let's say where I work mainly, Meru General, for example, you see, I'll say a lot of atopic dermatitis, that is eczema, a lot of acne, a lot of infections,
skin infections,
both viral, bacterial, fungal. These are the usual things. But mostly now those bad things, they don't happen more commonly.
Things,
common things happen more commonly. But all those blistering conditions, ulcers are very many, and so on and so forth. Vitiligos, these pigmentation issues, you've lost color, those things are there, and they are actually extremely common. And if the skin infections have really gone up in the last, this is a study that was done, sitakumbuka percentage, but it has really gone up. And the question is it that it has really gone up, or because dermas now has started capturing them?
It more.
And I have a feeling it's more of like, as we've discovered, people have known this dermatology, and we are reporting these things more. But uko mashinani mambo ni mingi.
Speaking of dermatology and mashinani, how many dermatologists are there in Kenya currently?
Very few. I won't give a specific number, but we are not anywhere close to being enough. Extremely few. And most mashinani don't have dermas, of course. So majority, hata ukitugawa, kila mtu ako Nairobi, Kiambu.
Hapa ndio kila mtu hapa.
So
we are really suffering in terms of
that's why someone from Bifuru Marsabit huko atakuja camp Meru, all the way again now from Kina Embu huko. The others will go to Thika. Na Thika it's like one person, like that Thika General. So you can imagine. Then side ya Nyeri na Nyuki. So now I'm talking about my side.
That's your
Where
side.
You come from, I think it's worse.
Uko sijui. I don't know. I've been trying to crack my head to remember a dermatologist
so it's that
there.
bad.
Even when in school, I went to Maseno. We were taught dermatology by a physician. I think they couldn't.
Even myself, we were taught by a pediatrician. So.
By a pediatrician.
And now, the issue is that the fact that when us were right now, people are getting really good dermatology training, because the main medical schools now can get a dermatologist to train. So for us, nasi ati tulimaliza kitambo. I don't know, which year did you finish MBCHB?
That was 2020.
Hey, just the other day. But now the point is, you can imagine, like for us, we didn't have dermas to train us. So the amount of training you are given was also one thing. So now you as a doctor, now again in the community, you're struggling with dermatology. So that's why these services are really
And me, by the things like these things you're talking about, atopic dermatitis, eczema, I've actually learned eczema in the practice. I've seen eczema because I've seen people treating it. I'm sure people who have not had access to maybe clinics with dermatology still don't know. The ones who went to school with, they still don't know. Most people, all they know is fungal.
Everything is fungal, unfortunately.
In fact, the other day, as recently as just this past week, I saw something that looks so much like psoriasis, because it was here, it was on these extensor surfaces. And this patient was on antifungal. They're like, I've been using this for like a month. There's no change.
I know.
I was like, it could be psoriasis, but I'm not sure. I'll send you to a derma.
Wow, now those are our sad stories. I don't even want to.
Sorry for the interruption. You were saying that that's over-the-counter
creams.
prescriptions.
So part of our nightmares is that someone will go get some cream. Most of the creams over the counter have steroids. And they start applying, and because it's anti-inflammatory, it cools everything. Okay, and it interferes with the morphology, how we are supposed to see things. And things will get worse, number one. Number two, when you come to us, it also misleads us. And sometimes you have to tell someone, now you have to come off all these things, and then we give you some time, we figure things out, because it can actually mislead, because good percentage of us as dermas, we use our eyes. Our eyes are our lab.
Yeah,
yes, we do labs and we do skin biopsies a lot, but mostly our eyes are
the diagnostic
really,
tool.
yeah, because now if you start talking of skin biopsies, it's very expensive as well. It's not like just picking your blood. You can't pick blood to check psoriasis or like emplaners or so likely just figure out mostly clinical diagnosis. Lakini sasa umeenda even actual fungal, you've used the steroids, we just see a patch, you're like, because there's a way a fungal infection must look like or should look like.
Wait, a lot of medics watch these young doctors. So let me ask. Well, probably some of us will not have access to referring a dermatologist. But if I'm to refer to a dermatologist, I've seen, okay, this probably I don't know what it is, and I need to a referral. I shouldn't prescribe anything. For example, the steroids, because me, I'm guilty of that.
Yeah,
I'm guilty of giving steroids.
I would rather you don't. Remember, most creams like are combinations. Itakuwa na steroid, antifungal, antibacterial. So you'll not see any derma giving like 3 combos,
because they know
what you're dealing with. So our issue is that most people out there will give all this. You see, if you give something clean and someone said I've just used this, I'll likely figure out kama ni hii pekee then ilikuwa hivi, because I'll know the effect. I won't even know which effect is working among these 3. So that's why it's a bit misleading. But if you have, let's say someone is really itchy, like and they are red and all that, and they won't see a derma in the next blah blah blah, then I'd rather you do, if it's you have to do a steroid, a mild one, and it's kind of pure. But of course, if you see here there's an infection, it doesn't matter what was there, but now kuna pustules and pus. Of course, if it's kidogo, do topical antibiotic. Of course, now as a doctor,
don't combine,
don't throw everything there, because now even the actual steroids could make the condition worse. If you can, as a doctor or even a clinician, you can figure out you can treat symptoms but not blindly as well. And then what I tell people, you can even tell them to take pictures and store them, and then go show your doctor. You can go around, even you sometimes, you know what people do, they take pictures, send to me, and they tell me I'm sending this patient, I have given this and this, such things. So it's tough, because I can't say don't treat, because I mean, again, how many dermas do you have?
Exactly.
So most of the time it's you who will treat everything. So hapo it's a gray area, so tuta survive.
Wacha tuende tufanye dermatology, some of us tuongezeke, si ndio?
True.
Good. Last thing, Daktari, people harm their skin. And this has been an issue of Africa, because as we started, we were saying we've been brainwashed to believe that being light skin is being pretty and all that. People do bleaching. Is there a counter? Like if you see somebody who's bleached, how would you treat that?
So if if we are to go back to what we discussed, even without going further, someone can tell then if this melanin is this protective, then it's obvious I shouldn't interfere with it. So it should be self-explanatory, because now look at it, I'm under the sun, I'm in tropics, where we have just said if you put a white person here, they will likely, and they don't take measures, they will likely get skin cancers. And now if you bleach, and we've seen another good example is with albinism. They don't have the melanin, and albinisms are getting skin cancers. That is the truth. Okay. If you have melanin, it will be rare for you to get skin cancer. So just deduce that. So you're like 100% bleaching.
So when you bleach, you're interfering with melanin the production.
And then it means you really need to do good sun protection. But now I would go back to the basis. Why are you bleaching in the first place?
To look good.
And in this
so that I appear in a music video.
Black is bad. Okay. So we said uniform tone. So whatever color you have a uniform tone, you'll be beautiful. if you're skin bleaching, you have to do 100% the work of melanin. That is sun protection as well. And then you need to do the vitamin, now the vitamin D, the supplements as well, because then you should not go under the sun. And then remember, skin bleaching, you likely have to maintain it. It's so hard for you to have permanent thing. And for you also to maintain, what are you maintaining with? What are the side effects? But it's a continuous work. So that is total bleaching. But remember, there is also, can I say, brightening. So you've come with darker skin on the face, now it's not your true color. We actually give you some products to take you back to your tone. So I don't talk about brightening or bleaching, because the truth is that's not what we are doing. We are like
making
trying
tone normal.
Uniform and normal. Okay, and then we also use the same products because you have, like I said, melasma. So we are fighting that thing. But now there are those who use the same products, apply the whole body, blah, blah, blah. That might brighten. It won't be permanent, of course, because that's not your color. Your melanin it's there. It has to fight to give you what it's meant, natural, what you're given by God or evolution, depends where you belong. But then that is it. So if you're messing up with that, you have to pay for that as well. You have to maintain it safely. You have to do sun protection and all that. But then the first thing I asked is, why are you bleaching? Because people come to me as well, but they can bleach you very safely, because part of the training, like when you're doing aesthetics, part of the training is also how to safely bleach someone, because those are part of what people want. But I don't. I'll give you the I will not. I told you I can't even buy a white dolly for my child. So I will not. Like, what am I now doing? Like, I'm also like helping you to say that your natural color black is inferior or it's bad. I'll help you get your skin tone. I'll tell you, do this, apply this, get your skin tone, which is uniform. But I can't bleach you. I can't get you beyond below your skin tone. And I can't practice that like my own. I don't know, it's not ethics, because you can bleach ethically, but my own person cannot allow me to do that. So I'll likely do some counseling. And some people see the light, actually, not even the medical thing, what we just said, it's the psychological thing, like what is leading you to do this. And I've changed quite a number of people, but those who don't even want to listen to you, or they have listened, they tell you at the end of it, and now I'm making my own consented decision. I want to bleach. So yes, but then I sort of direct them in the right way, because at the end of the day, they're patients. You don't want them dying everywhere.
True. We're doing it in a
just
very
advise
bad way.
them. Then you go. I know there's this one who might agree to do it, but I have done my part. So that's it. Bleaching medically, being in the tropics, is just wrong. But if you're able to maintain it and you're convinced you really want to
you're
do
beautiful the way you are. But you can normalize your skin tone if you feel
you can make your tone uniform. And to be beautiful.
Before we started, you were talking about Botox.
Oh yeah, as a side show.
Tell us 2 or 3 things about that as we wind up.
Botox, we talked about Botox. I was ordering Botox. So Botox is anti-aging. So Botox is not purely aesthetics or cosmetics. It's both cosmetics and also treats other conditions. For example, I'll start with conditions. Say something like blepharospasm. So those people of course, they go to the ophthalmologist, get evaluated, and then the ophthalmologist will tell us if we can. There are those who do the Botox themselves. Others, like in Meru, they will send to me. So we inject just to the muscle that is twitching to chill, because it's quite uncomfortable.
So Botox relaxes the muscle.
It does. Or someone with Bell's palsy, for example, paralysis one side. So we kind of try to normalize with the other side. So if your mouth is going all the way up, or something like that, we want to relax the normal side, so that at least there's some symmetry.
You target the muscle, not the nerve.
Yeah, actually, Botox, we target the muscles. Just to normalize migraine, there are points that we can inject and make migraine better, but we need to be 100% sure, meaning the physician will tell us this is pure migraine. They are not eye issues. They are not all these issues. Which other condition? I just remembered the ones I treat, but now there are quite a number of. Oh yeah, now I have a patient who is also kind of a relative who has bedridden, and then now the muscles, like they can't stretch the muscles. These are what the hamstrings have become so tight and they become so painful. Unfortunately, you have to do very high volumes of Botox actually. These I didn't know, so I knew through the orthopedics, those people, the orthopedics, and they suggested they can actually Botox can actually help. So this is a new thing I just learned the other day, because that's not my area. But yes, and actually, like for that one, that specific insurance that they had covers that, because even the patient I have for Bell's palsy is covered by
the Botox
insurance.
was covered by insurance.
Yeah, Botox is not covered by insurance, so we had to really present this case, and that's why I'm telling you now. Botox can go on the other side. It's just not what we know Botox near wrinkles and all that. Now, aesthetically, there are other medical applications. I'm just saying from my experience what I do. Now, the other side, now which I do mainly, which was the initial thing I started before, I progressed, is aesthetics. So aesthetics is just simply just relaxing your muscles. If you're forming these heavy lines here, the dynamic before they become permanent, you relax them. So it's like a paper. If you're always kunjaing a paper, it gets old. But now what Botox does is like it straightens it and holds it in place. So now those wrinkling do not get permanent and permanent.
So you can't do this?
Exactly. You can raise your eyebrows, but now we do it in a way that you don't become plastic. So you can raise your eyebrows, but the muscle kuna vile tumeitengeneza. These lines here, these lines here, hizi za hapa. Before now they become permanent and they're there. We kind of sort of try to relax them. Usually we repeat after 6 months.
But these things are for the rich, eh?
Not really. Personally, like because in Meru, I try my best to make aesthetics,
affordable.
Something, affordable. I know in Nairobi, sometimes I also hear prices and I'm shocked. But there are so many other things that people can afford. Like, for example, if you have issues, you can do chemical pills that are a bit cheaper. Their microneedling will not be as expensive as Botox. And these actually are collagen formation. Aging is losing collagen.
Yeah.
So there are things that make you produce more collagen to hold your skin in place. So these things are available. We do them. It's part of anti-aging. Botox is more like dramatic. It will not add collagen. So everyone doing Botox, I encourage them to also do other procedures that are collagen producing.
Collagen friendly.
Because Botox, just fine. All the wrinkles will go, but it doesn't add anything extra than that. So we do that, and then we add other things just to maintain your collagen, because you lose collagen, you get old. That's the thing actually.
Wow,
and the saggy skin
that's
and
a
all
whole
that.
other discussion. Wow, dermatology is a lot.
It's a lot. So this is more like aesthetic,
Yeah,
the cosmetic
aesthetic part.
dermatology. There's the clinical dermatology, there's dermatopathology, and then there's the surgical dermatology.
So why did you choose this? You were telling me your parents were really shocked. Why dermatology?
No, when
for
I
you?
said not even parents as such, actually, that being my actual parents didn't have much. It's more of like my relatives work. They were like, dermatology, because again, people don't know about dermatology. So they would have been happier at that time if they had, I'm going to do neurosurgery or see what those
gynecology,
surgeries, or, but then now they are very proud, because we've made dermatology known. Like now, personally, I'm talking about mashinani, because I think we are like the initial people who really
went out of Nairobi.
And the environs of Nairobi. I know Nakuru had someone from Kitambo, Thika had Nyeri, and actually the age gap is so extreme, from those who started dermatology services then. There are people who are extreme age. In between, there's still no one. Now it's now as of really now made dermatology, started dermatology at this age in mashinani. Yeah.
Doing good job. Hujatuambia about why you chose it,
why I chose dermatology
over everything else.
It's a mixture of so many things. One, good selfish things and non-selfish things. So more of the truth is that I also used to Google to treat dermatology. When you put in OPD as a medical officer, now you're seeing things and you have no clue. We just knew acne, and even acne we didn't know how to treat. You can tell it's acne, then you're like, what should I give? So, and then I was also in Mashinani for my attach as an MO, now medical officer, and I saw a lot of this, and it was obvious, like there is no derma, there's nothing. But also getting a training was an issue as well. So there's more of the uniqueness, yes, but what is this that is not available? And then and it was kind of exciting, of course. And then the selfish way, and of course there was some also influence kidogo, even from those ahead, and they know dermatologists like that. So I think my husband had something to do with that as well. you know this, but not the selfish things were like, which we didn't know. At that time, I didn't know dermatology is like such a huge thing.
It has a lot of money.
Not even, I never thought about money. I thought like no calls at night.
I see you.
Nita chill too. Which is true, of course, you can't compare with, to some extent it's true, but there are also still emergencies that you'll go to the ward still. But now my ward round will not be as heavy. You can't compare at the end of the day. But you have patients' lives also on your hands. It's not what you think even now, because people make fun. And like before time ya COVID, unaambiwa vaa mask kama utaintubetwa na dermatologist. And even when I finish, people, they tell me a skin issue, and then wananiambia ni sana, kuna shida ingine mama, nauliza, and then they're like, hiyo ingine nitaenda kwa daktari. I'm like,
where's the daktari?
I'm like, oh my God. That's how much people didn't understand dermatology. So they are shocked that I can also help with these other issues, and then I can advise them, ikifika hapa, see especially. So they can't, believe. But now they have learned. We are doctors.
Amazing. Yeah. We have so many dermatology jokes.
I know they're there. You're seeing emergency room is on fire and we are just chilling. Those are the jokes, but we will help.
You're coming out there with your creams. With your sunscreen. Do you want?
There's so many jokes even outside there about dermatology, but
I like your passion for it. I think you really like it too much, and that's highly encouraged. As we're doing nominations, we are voting for Medics of the Year. We're looking to have awards. Guys, keep nominating. And dermatology is also a category. Nice. You can nominate Dermatologist of the Year. Dr. Gasheri here.
Amen.
We give you an award to kwambie Daktari for being in Mashinani and helping people all the way from Moyale. We see you and we appreciate you.
Very true. Thank you.
Daktari.
Yes.
As we wind up, parting shot, last word.
Parting shot, just take care of our skin, I would say that, and msidharau hiyo kitu ndogo. Sijui kakitu kamegrow hapo, nini ni skin, haina uchungu. It doesn't hurt to have it checked, and there are people who come and I tell them paka Vaseline and they feel like I came all the way, I paid consultation kuambiwa hivi, and I tell them what you have done is more important than you can imagine. Two things. One, it would have been a bad thing. You don't come, it goes bad. Number two, you would have gone somewhere else and then you treated wrongly and you get the side effects of those drugs. So no one should ever say hii ni kitu ndogo. Usidharau. Skin is the largest organ.
It's
extremely important. So we need to take care of our skin.
First protective barrier. Sawa. Daktari.
Yes.
Thank you for coming all the way from Meru to come to Daktari a quick one, and we really appreciate you. I am sure there's still more we can talk about. It's story to make it too short because time is now running out. But thank you so much for showing up.
Thank you for having me.
Karibu.
Okay.
See you next time. Daktari a quick one. Kama kawaida, piga like, subscribe, comment, and share. Dr. Gasheri, they can find you on TikTok.
TikTok is Gasheri P. Kathiri. Kadhiri, like Kathiri.
All right. Yeah. Okay. Amazing. And actually, she teaches a lot of dermatology on her page, and that is how I found her. And you can go check out what she talks about. It's amazing content.
Yeah. Thank you.
Daktari,
yes.
Thank you for coming.
Karibu.
See you next time. Daktari, a quick one. Adios.